comes a time when we hear a certain call, when the world must come together as one. There are people dying, and it's time to lend a hand to life, the greatest gift of all. We can go on pretending day by day that someone somehow will soon make a change. We are all a part of God's great big family, and the truth, you know, love is all we need. We are the world. As it has been for the past couple of months, for many of us, our lives have been significantly and dramatically affected. With the physical distancing in place, we have found ourselves interacting less with our social contacts, and for some, this period brings about a lot of uncertainty and loneliness, fear of the unknown, and anxiety about the future, like what will happen tomorrow, what will happen next month. There's financial insecurity and not knowing where the next meal will come from. For others is increased alcohol intake or marijuana use. Others are having erratic sleep patterns, not sleeping at all or sleeping excessively. Changes in their appetite, either they're eating too much or not having any appetite at all. For others, they are facing violence from a parent or from a spouse. For those working from home, you may be having difficulty paying attention during the meetings or meeting your deadlines. For others, you are arriving late for the meetings or forgetting the meetings altogether. I mean, in some way, we all have been affected in one way or another. But today we're going to focus on stress, loneliness, and depression. Stay tuned. First of all, let's separate the terms. Usually when we talk about stress, we attribute it to something bad and unwanted. But stress can either be positive or negative. Good stress can increase your motivation, increase your concentration, and your overall performance in the end. Bad stress, on the other hand, can reduce your motivation, reduce your concentration, make you worry and feel over the edge the whole time instead of performing what you're supposed to perform, and in the end, it's a negative outcome. And that's the one we should be worried about. Loneliness can happen when we attribute our friendships and our social relationships to be less in quality or quantity than we would have desired for ourselves. Meaning that you could have 500 friends and still feel like you're alone. And someone else could have 3 friends and feel content with the kind of relationships and the quality of relationships that they have developed with these 3 people. Therefore, loneliness is not the physical act of being alone. Now, when it comes to depression, many of us abuse that term on a day-to-day basis. You've had a boring day at work and you're like, oh, I'm depressed. You've been walking on the sidewalk and someone just splashed mud on you and you're like, oh, I'm depressed. Your girlfriend of 4 days has just dumped you and you're like, oh, I'm depressed. You've ordered food online on Glovo and they've arrived 30 minutes late and you're like, oh, I'm so depressed. No, depression is more than just a bad event or a bad day. It's a sustained and a prolonged feeling of sadness and loneliness and feeling empty, feeling worthless and useless and feeling like there's nothing to look forward to, feeling that there's no hope for tomorrow and no hope for the future, no hope for you. And this can be triggered by anything really, depending on how much it means or meant to you. Now, this sustained feeling can cause changes in our sleeping patterns. It can also interfere with our eating habits. Either we eat a lot or we eat less. It can also give us random physical body aches and pains. And when you go to the doctor, to your general practitioner, you're done for all the tests and there's nothing really that is found to be the cause of this pain. But all is not lost. If you feel that you may be developing signs and symptoms suggestive of depression, there are some things that you can do to help manage and prevent things from deteriorating further. But first, if you've been having crying spells or anger outbursts or erratic decisions and risky behaviors or just feeling suicidal, please, it's very wise to seek professional help. This could be from a general practitioner in a general hospital, or from a mental health specialist that's a psychiatrist, or from a mental health nurse, a psychologist, a counselor, a friend who can connect you to get assisted. This will be very helpful. And the kind of help you may get will be maybe therapy or medication or even both. Next, you can get a personal therapist, what I like to call a live punching bag. This is a friend whom you can confide in and talk to about your deepest fears, your deepest secrets, and just talk to them about anything. And please, they have to be non-judgmental, they have to be honest with you, and they have to be available to talk to you to a reasonable extent. Next, you need to keep yourself busy. An idle mind? That's right, you need to get something that keeps you going, keeps you moving, keeps your mind involved. Whatever it is, however bad or however good you are at it, as long as it's something healthy and legal. Please, it has to be legal. Next, if whatever is causing you so much distress is something identifiable and something that you can point out, you have to find ways in which you can either get rid of it, you can either solve it, or just find coping mechanisms on how to live with it on a day-to-day basis. You can do this by yourself or with the help of a friend or a therapist or a life coach to just guide you through the whole process if need be. Next, try and focus on the good, however little and however subtle it may be. This has an effect on raising your mood and just uplifting your spirits. Practice smiling as much as you can and just being as positive as you can be. Next, avoid social isolation or social withdrawal. What you're practicing currently is physical distancing and physical isolation by staying at home and not interacting with our friends as we normally would. But we can still stay connected with our friends, our family, our peers through our social media platforms and whatever other methods that you use to stay connected to your people. And finally, we cannot forget exercise, eat healthy, and have good sleep hygiene. So today we've talked about stress and depression and highlighted some of the things that you can do to manage or prevent depression, especially during this time. And the discussion is far from over, but this week I want to challenge you. Once you're done watching this video, to just go to your phone book and just pick 2 of your friends. Just 2. Call them or text them or video chat them, whatever you choose to do, and just find out how they're doing. Find out how they're coping through this time. And tell them I wish them a lovely week, and to you too as well. We've come to the end of our session today, but the conversation is far from over. Drop your comments and your questions below, and remember to stay home, stay safe, comesha corona, and let's protect our health workers.